There's a problem that many women are hesitant to talk about, yet it's one that affects millions of ladies of all ages, really. We're talking about urinary incontinence, or a leaky bladder. So today we're going to tackle it head on while shedding some light on a new solution. Dr. Therese Stubbs of Therese Aesthetic Medicine is here to tell us how it works. So good to see you, Dr. Ann.
Thanks so much for having me.
Now, this used to be a taboo subject, though it slowly is kind of coming into the forefront. We were talking. So how common really is a leaky bladder?
This is very common, especially in young age groups after having had babies, and it's very common in perimenopausal women because the hormones change, and so people can get some laxity of the female structures, and the bladder just kind of, tends to leak when people jump rope in a workout class, or when they jump on the trampoline with their kids, or even when they cough or sneeze. They feel like they have to really cross their legs or wear some kind of protection so that they don't have urinary leakage.
Right, and these are things we all do all day, right? Everybody can't stop from coughing or sneezing or being normal, so we want a solution that's going to stop it for good. Thermeva is what you're talking about.
It's brand new this year, and it's remarkable. It's been appealing to very young moms who are right out of childbirth because they want to be active with their kids and not have to worry about wearing a pad or wearing some type of tampon that keeps them from leaking urine during the day. And it is kind of a taboo subject because it's not everybody's favorite thing to talk about.
Oh, I know. I wouldn't imagine.
And I think any woman that you talk to after having babies says her body is not the same. Same thing with women going through menopause. They say, wow, I didn't know this was coming. This isn't the same. And so it affects daily life, and they want to continue to exercise. They want to run. They want to be able to laugh and not cross their legs. So this is something that's non-surgical. It's radio frequency heat. It heats all the female structures, thus tightening them. So basically it's a one office procedure every 30 days for a series of 3. So it's about 30 minutes, very comfortable. Nobody's been uncomfortable during this procedure. We've been doing this since November. Usually people right after the first treatment see immediate tightening. They see visually a difference, and they feel a difference in that they don't have the stress incontinence. It gets better after the second treatment, and after the third treatment, usually people are completely rid of their stress incontinence and any bladder prolapse too.
So let's talk about over the course of then those 3 treatments, you're going to see results really each time, and after the third, hopefully, it's gone and not coming back.
Right, and then we just recommend that people come back maybe in 12 to 18 months for one kind of maintenance treatment. So maybe one maintenance treatment a year thereafter, and that's what the literature is showing right now. As I mentioned, it's a very new product. Up until this point, women have been told, do your Kegels exercises, take this pill to tighten the bladder, or, have surgery, a very invasive bladder sling surgery to keep from having these problems. And this is a very non-invasive, very safe and effective procedure with no medication and no surgery.
I love what you were talking to me about this just before the segment, and you said a lot of women describe it as life-changing.
That's the biggest word I've heard. I have a patient who's a nurse. She said every time she lifted a patient in the OR, she would feel like she had to bear down and she didn't want to, or she had to wear a pad every day. She said after the very first procedure, she didn't have to wear a pad to work anymore. And this is a young gal who's very active. So it really, they find that it liberates them from having to worry about an embarrassing moment.
And one of the big advantages, which you mentioned briefly, is there is no pain associated with it. This isn't something that they're going to go in and be uncomfortable during.
Not at all. Not at all. And anyone who's had their basic pap smear or pelvic exam, most women say this is no worse than a pap smear. This was easy. And it's about 30 minutes. You're in and out of the office, can resume all activity that day as normal, don't have to wear any type of garment or anything. And the immediate results are the heat actually makes the collagen kind of go into a remodeling mode and kind of swell a little bit. So all that nice swelling is a nice tightening, so that the stress incontinence tends to go away. People also pursue this for increased moisture in the vaginal area after menopause. When women get very dry afterwards, this restores the glands that make the moisture. So it's been kind of a 1-2 punch for women in kind of rejuvenating the whole female structure area.
Right. It sounds like it solves a lot of problems. So the best thing is come in, talk to your team, see if it's right for you, and you, as always, offer a great deal for this.
Yes, we're doing 20% off the procedure for daytime viewers. And as you mentioned, I think it's very important just to come in, have a consultation. We go through the medical history and make sure there's no reason that you can't have the procedure. At this point, only people with pacemakers are contraindicated from having this procedure because it's a radio frequency and we have to put a grounding pad on, which might interrupt the communication. But other than pacemaker patients, everybody's been a candidate, which has been wonderful, everywhere from 30 to 80.
All right. Well, Dr. Ann, as always, thanks for helping us ladies out. Thanks for being here.
Always trying. Thanks so much, Robin.